Our program here in Jasper is unique because it really involves two great institutions. We have our sponsorship with Indiana University School of Medicine, which is the largest medical school in the United States. So that gives us lots of great academic resources for our learners. But we're located here in Jasper at Memorial Hospital and Healthcare Center, which is a community hospital in a rural setting. And that gives us a great opportunity to really practice family medicine right in a local community where the action really occurs.
Being in a small organization, especially in this community setting, I feel like I have the opportunity to do a lot of things I might not be able to have done if I was in a larger institution. We are the residents in this training and this program, and so we get a lot of exposure that we probably might have to fight for in a larger institution because there are other different specialties of residents. So I really like how I get exposure to, dermatology issues, complicated pathology that I can manage within the scope of my training before I need to refer them to a specialist that could be maybe closer in town or at a different town.
Jasper being a community setting in a rural area, we have just our family practice residency. Residents will get firsthand training in each of their rotations.
We're not really training them to be surgeons here, but I think in their work with the critical care docs and the hospitalists, they learn a lot of in-house procedures, particularly in the intensive care unit. Obviously, they help us in the operating room as well, as much as they feel comfortable doing. But they're going to be future primary care doctors, not surgeons, and we recognize that, and I think that we educate them specifically with their career plans in mind.
In our didactics, I get to see them learning from our speakers. So it's been really rewarding to see them learning firsthand from anybody in our organization. It's been really nice to see them develop that mentor-mentee relationship with everybody in the organization who wants to be a part of the residents and wants to be a part of their training.
This program prepares residents to begin their careers through certification and just understanding that we would like to train physicians who we would like to become our colleagues.
How I felt welcomed by the community was really highlighted within the first, 6 weeks of the program. I just started seeing patients, they were all new to me. I had one new patient who started asking questions about my life, where I was before this, and by the end of our appointment, she was asking where I was going to end up. And I told her that I consider Jasper because it's a place I could see raising a family. And after that, I ended up getting a letter in the mail from her and on my mailbox. And she was espousing all the great scenery, all the things to do around the town, and that she hoped that I would stay afterwards. So I think that was one of the most warm welcomes I've ever received in a place I've lived.
Family medicine is a broad spectrum of care, and so our residents really get a broad experience so that they can practice in the way that they want to once they graduate. So we have resident graduates who focus on outpatient medicine, inpatient medicine, or specialize even in certain areas of medicine. And so really the broad spectrum that we can provide here prepares them well for whatever they face in their future.
So I think they get a very good experience here. We have somewhat of a rural setting, but we still have a lot of high acuity, a high volume of patients. They get a lot of hands-on experiences, so they see everything that comes in the door, from traumas to strokes to STEMIs. They get hands-on procedures here. They can do, whatever they would like here as far as suturing and fracture reductions, splinting, airway management, intubation, central lines. We get a lot of that stuff even on a daily basis.
I feel like every time we get to do a delivery with a clinic OB patient with Dr. Conrad and Dr. Luff, we really get to be hands-on, deliver the patient on our own. One of the great things about OB is that we get to see the mother from her prenatal visit all the way through to her postpartum visit. So we provide full spectrum care during the pregnancy, and then after that we also get to provide care for the baby.
The residents on my service, when they rotate with general surgeons, have a lot of hands-on experience in the operating room. I try to train them in the things that they will need in clinic to be procedural people when they go out into practice. But my rotation is not just a stand back and watch the attending do their job. They're very involved in the operating room as well. They're my first assists some days.
The inpatient medicine rotation definitely benefits them from a general family medicine perspective. I think from the variety of cases we see, number one, I would say also understanding what patients are sick enough to be in the hospital and what patients can stay in their clinic if they're going to remain an outpatient physician. And then also learning how to manage those patients themselves if they take more of the traditional family medicine path that still exists some places where they would see patients both in their office and the hospital.
Watching our residents become part of this organization pretty flawlessly from the time they came here has been a pretty proud moment. Watching them become well-rounded, well-educated physicians, watching them be integrated into our community, watching them be welcomed by not only the people that work in our organization, but the people that live in our community, that makes me proud. Just seeing the community that I grew up in welcome them here, that's a proud moment for me.
Know that you are on the threshold of a major decision. And I would just tell you that we are very committed to our family medicine residency program. Consider us as you weigh your many opportunities, and we wish you the best as you go through this process. Thanks for your time.